Do you sometimes feel like your muscles are suddenly failing you? Maybe your eyelids droop or speaking becomes hard. Imagine eating your favorite canned beans and feeling perfectly fine, but 12 hours later, you can't even hold a glass of water. That's how botulism starts, quietly but dangerously. Botulism is a rare but serious illness that attacks your nerves and muscles. It doesn't spread from person to person, but it sneaks in through contaminated food, wounds, or even in babies through honey. Think of it like an invisible robber that paralyzes your body from the inside. Scary, yes, but knowing about it is your best defense. Imagine you found an old bulging can of soup in the back of your kitchen cabinet. You open it and there's a strange smell, but you cook it anyway. That could be dangerous. Botulism is caused by a poison made by tiny bacteria called Clostridium botulinum. These bacteria love dark, low-oxygen places like canned foods, especially homemade ones. When they grow, they release a toxin, one of the most powerful natural poisons known. Even a tiny drop can make you very sick. Babies can get it from honey because their tiny tummies can't fight off the spores yet. Wounds infected with dirt might also become breeding grounds. So it's not the bacteria itself, it's the poison they make when left unchecked. How do you know if it's botulism and not just bad food? Here's a clue: it doesn't cause fever or stomach cramps like most infections. Instead, it attacks your nerves. Let's say you wake up and your vision is blurry, like looking through a foggy window. Then your mouth feels dry and your voice becomes weak, like a whisper. Soon your arms feel heavy and walking becomes tough. This is the toxin blocking signals from your brain to your muscles. In babies, signs include weak cries, floppy movements, and trouble feeding, like a rag doll. These symptoms usually appear 12 to 72 hours after eating bad food. The worst part, if untreated, it can stop your breathing. If you notice these odd nerve signs after eating canned or preserved food, act fast. Detecting botulism is tricky because it looks like other nerve problems. Doctors ask, did you eat home canned food? Have you used injectable drugs? Any wound infections lately? They will test your blood, stool, or the food you ate, but results take time. While waiting, your doctor might use a nerve test, pressing a muscle to see if it responds slowly. The good news, there is an antidote called antitoxin. It stops the toxin from causing more harm, like putting a shield around your nerves. But it cannot fix damage already done. That is why quick treatment matters. Severe cases need a breathing machine and weeks in the hospital. Full recovery can take months, but most people do get better, especially if treated early. Can you stop botulism before it starts? Absolutely, and it's easier than you think. First, never feed honey to babies under 1 year. It's a hidden danger. Second, if you love home canning, learn safe methods. Use pressure cookers, not boiling water, for vegetables and meats, because those bacteria survive boiling. Always toss bulging, smelly, or leaking cans. No tasting to check. If you see foam or cloudiness in a jar, wave goodbye to it. When camping or storing food, keep things cold. And for wound botulism, clean deep cuts well and avoid injecting drugs. Prevention is like locking your doors at night, simple habits that keep the danger out. Scientists aren't sitting still. Recent advances include faster tests, like a new lab tool that detects botulinum toxin in hours, not days. Researchers are also working on new antitoxins that work faster and have fewer side effects. Excitingly, there's ongoing research into using tiny parts of the toxin in safer forms to treat medical conditions, like chronic pain or muscle spasms, turning a poison into medicine. Other studies explore better vaccines, especially for at-risk workers like lab scientists. So, while botulism remains dangerous, science is building smarter shields every day.